When I discuss with patients surgery for a disc herniation for symptoms, one of the things most spine surgeons will think about is one of the things that can happen after surgery, and that's a recurrence. Recurrence meaning another piece of the disc comes out after you've removed it surgically. The reason that will typically happen is there's a defect in the hole or the covering in the disc called the annulus. The larger the hole, the higher the risk of a recurrence. When I would have a patient with a large defect and I knew there was a very high risk of a recurrence, I would be much more aggressive in removing a lot of the disc, meaning going into the space where the nucleus, the gooey portion of the disc is, and pulling out as much of that disc material as I can to decrease the risk of a recurrence. The problem with that is you're removing all of the cushion. So if you take all of the cushion out, that disc could collapse and degenerate very quickly. The pain from the disc herniation, which is typically more pain in the leg, would usually get better, but often those patients would come back with very bad back pain because they no longer have a cushion. With the Barricaid, instead of doing that, I feel like I can close the hole and not remove a large portion of that disc. If we see a defect and we can close that defect, we should feel confident that your risk of recurrence is going to be significantly lower than if we didn't close the defect.